When you're initially diagnosed, almost everyone will have at some point an echocardiogram done. And basically, it's like what pregnant ladies have with babies is a sonogram or an ultrasound of the heart muscle. And it really delineates or shows really well what the squeeze of your heart muscle is doing. And that'll be something that your heart failure clinical team may need to repeat, as you kind of are put on medicines and, we think about your NYHA class and what's not. So that's important. There are also some blood tests that we like to track, and sometimes over time as well, and certainly when you're first diagnosed. One of the most common things we look at are blood tests, either a BNP, and some hospitals use a NT-proBNP. Similar parameter though, and basically it helps us understand whether your heart muscle is doing well or not. Think of it as a blood stress test in some ways. So we'll do blood tests. We'll do echocardiograms, and then we'll try to look for specific causes. As my colleagues have mentioned, Dr. Jane alluded to it at the beginning, there are certain things that predispose you to heart failure. So if you're a person who's got coronary artery disease or might have had a heart attack in the past, you may require a stress test for ongoing assessment. If you're a person who has a specific type of heart disease like cardiac sarcoidosis or amyloidosis, there are specific scans that your heart failure team may require initially and for follow-up. So I think one of the main things to take away in terms of testing is that it's very individual. So what you've got to do is to work with your healthcare team to ensure that you've got the appropriate follow-up. But perhaps the most consistent things that will follow over time are going to be the echocardiogram and the BNP assessment in conjunction with the stage assessment, as Dr. Jean laid out, and the NYHA functional class assessment, as Dr. Paul beautifully laid out. And I think once we bring those things together, we're better poised to help you manage your cardiac issues.